Hey guys, the topic for discussion today is Darrow Yannet diagram. So Darrow Yannet diagram is all about the compartments of the fluid in the body, their osmolality and volume changes in different physiological as well as pathological conditions. So Darrow Yannet diagrams gives us the representation of volume of the total body water ICF and ECF and the osmolality of the respective compartment of the body. So this is the first diagram is the representation of the normal condition, which is 300 milliosmoles per liter. Here the thing that you need to understand is in the Darrow Yannet diagrams you have both compartments, that is ICF and ECF. In the previous lectures, I have already discussed about the total body water and its composition. So total body water is divided into ICF and ECF. And again, this ECF, which is extracellular fluid, has something extra in it. So you have to divide it again into interstitial fluid and plasma fluid, guys. So this is the video that I have already done, which is regarding the body fluid levels in the physiology playlist. You can find it. That is the most important and the most frequently tested topic. That also you have to watch. Firstly, let us understand what is related here, like regarding ICF and ECF. So ICF is more, which is 2/3, and ECF is 1/3. Similarly, interstitial fluid is 15%, whereas plasma is only 5%. So what you need to understand is always the term that starts with I is more. So the term ICF, intracellular fluid, is starting with I, so it is more compared to ECF, and the term interstitial fluid is starting with I, so it is more in comparison with the plasma, which is just 5%. So this explains us the diagram in which ICF is represented in the bigger compartment, which is 2/3, and ECF, which is represented in the smaller compartment, that is 1/3. And on the x-axis you have this volume representation, on the y-axis you have this osmolality representation. So initially the normal diagram is colored with black dotted lines. Now let us understand the different types of Darrow Yannet diagrams and their representations and what all you need to know in this topic. So I have got you this PDF which shows you the images of all 6 different conditions of Darrow Yannet diagrams and the tabular format which summarizes everything, and here also you have few questions related, or a diagram which shows all the 6 types of Darrow Yannet diagrams. So let's get started now. Firstly, the first diagram. Let us discuss about the first diagram. I'll be pointing out the normal and the ECF and ICF volume after the physiological change or the pathological change. So look at the pointer properly. Firstly, the black lines here is the normal one, right? So the black represents the normal, and here the green is regarding ECF and the red lines is regarding ICF. So now let's decode this first diagram. Firstly, the ICF compartment from black to black is normal. Now let us see where the red lines are extending. So the red lines are also extending to the same portion, that is ICF. So ICF volume is normal in the first diagram. That is, there is no change. Coming to the ECF volume, look at here. The normal ECF volume is from black to black, whereas the changed or the after the change, the ECF volume is decreased here. From the green line it is moving towards, from the black line it is moving towards the green line, so it is receding back. So this is the new ECF which is changed, and the change in ECF volume here is decreased. Now let us discuss about the osmolality. So when we talk about osmolality, all the lines, that is the green, red and the black lines, are at the same level, right? All the 3 lines are at the same level. That indicates there is no change in osmolality. So let me write the same thing here. In osmolarity, there is no change. That means the condition is isotonic volume contraction, because the osmolarity, there is no change, that is why isotonic, and the volume, that is the ECF volume, is decreasing, that is contracting, so it is isotonic volume contraction. So guys, here you need to understand one concept, that if you take this as the ICF compartment and this as the ECF compartment. Whenever the changes, it might be loss of fluid or gain of fluid, whenever the changes occur, first compartment to be affected is ECF. So whenever there is a fluid loss in ECF, what happens is, see, whenever there is a fluid loss in the body, first volume to retract, the first volume to contract is ECF. So ECF decreases in volume in first place. ICF remains the same. So the main thing here that I want to emphasize is any loss or gain in the body fluid is first affected in the ECF. And one more concept that you need to understand here is regarding the osmolarity and the fluid movement. So if we consider these two are different compartments, let us suppose the volumes are equal, or the volumes might be different also. Let us suppose these are the two compartments, 1 and 2. In the first compartment, let us suppose these are the solutes, and in the second compartment you have solutes very sparsely. So that indicates that here there are more solutes in the compartment number 1, so the osmolarity of the solute is high when compared to the osmolarity of the second solute, which is low. And compared to the fluid amount in the first compartment, in which the osmolarity is more, is less compared to the fluid amount here. So the fluid is more here compared to the compartment 1. So whenever there are two compartments side by, the fluid movement always depends upon the osmolarity. So the fluid movement is always from low osmolar to the high osmolar compartment. So since the low osmolar compartment here is number 2 and the high osmolar is number 1, the fluid movement is in this direction. So more amount of fluid is in 2, right? So the fluid moves in this direction. So what happens is, eventually the ECF contracts, right? Because the fluid is moving towards the ICF, and the ICF volume increases. The ECF volume decreases and the ICF volume increases because the fluid movement was in this direction. Because the fluid always moves from low osmolar concentrated compartment to the high osmolar concentrated compartment. So this is one more important concept that you need to know. With these two concepts in mind, let us discuss about all the types of Darrow Yannet diagrams. So first one I have already explained you, which is isotonic volume contraction. So what's happening here is there is a loss of isotonic fluid in this compartment. So there is a loss of, let me write it out. So there is a loss of isotonic fluid in this condition. So since there is a loss of isotonic fluid, as I have already told you, the fluid loss always occurs from the ECF compartment. So there is this contraction of the ECF compartment, right? So the ECF volume is decreased initially and there is no volume change in the ICF. This loss of isotonic fluid is seen in few conditions like burns, dehydration, diarrhea, vomiting, or loss of whole blood. So in all these conditions, you will see loss of isotonic fluid. So there is no change in the osmolality. The first diagram is done. Let us understand the second diagram. Let us try to interpret this. So firstly, black to black is ECF, right? So the black to black is ICF here, and the red lines of ICF are also same. That is, there is no change in the volume of ICF. When you see the green lines, the normal is from here to here. See, the normal ECF is black to black, whereas here the green lines are moving outside. So in total, the ECF volume, the new ECF volume is increased. So let me write it for you. When you talk about volumes, there is no change in ICF, whereas the ECF volume here is increasing. And when you look at the osmolality, the three lines, the red line, the black line and the green line are at the same level. That means there is no change in the osmolality. Since there is no change in the osmolality, you call it as isotonic volume expansion. You call it as expansion because the ECF volume is increased here. So this is isotonic volume expansion. And this condition you see when you infuse the patient with isotonic fluids. So when you give IV isotonic fluid to a patient in shock, to a person in shock, if you give isotonic fluid, the compartment diagram will be like this. So whenever you give a fluid or whenever there is a loss of fluid, the first compartment to be affected is ECF, right? So you gave the patient IV fluid and that fluid enters into the ECF compartment, resulting in the expansion of the ECF volume, whereas tonicity is same because the infusion that you are giving here is isotonic fluid. That explains you about the isotonic volume expansion. So in this diagram here, in this table here, first thing that we have learned is isoosmotic or isotonic is one and the same. Remember, isoosmotic and isotonic is one and the same. So firstly, isotonic volume contraction that we have seen, diarrhea, burns and sweating. What happening is ECF volume is decreasing, ICF is no change, and ISO, so no osmolarity change. So this is what is explained in the first Darrow Yannet diagram. And the second one, which is isotonic volume expansion, look at here. In this here, isotonic volume expansion, infusion of the isotonic NaCl. So that causes increase in the ECF volume. But since it is isotonic, there is no change in the osmolarity and the ICF volume is also not changed. Right? So this is what is regarding the first and the second diagrams, which is isotonic volume contraction and isotonic volume expansion. Now let us see the third diagram. So the third diagram, interpret along with me so that it becomes a practice for you. There is nothing to by heart in this topic, guys. It's totally conceptual. So firstly, the black to black lines, which is normal, and the red to red line is the changed one. So the ICF volume here is decreased. And let us look at the ECF volume. So black to black is normal, but here the ECF volume is moving outward. So the new ECF volume is high. When we talk about the osmolality, this black line is the normal one. But here, of both the green lines and the red lines, the osmolality is increased. So what's happening in total is osmolality of both ICF and ECF is increased. Coming to the volume of ICF is decreased, whereas volume of ECF is increased. So this is what is happening in this diagram. So this might be a condition of excessive intake of NaCl. That is, it is a hyperosmotic volume expansion. So look at this table, guys. When you see a hyperosmotic volume expansion, this is the third one. So hypertonic or hyperosmotic volume expansion is due to high NaCl intake. Like this can be seen in patients with high BP, that is hypertensive patients, this condition can be seen. So here what's happening is hyperosmotic volume expansion. There is more intake of NaCl. So there is more volume expansion of the ICF and decreased ECF volume. And since the osmolarity is increasing, there is a change, that is increase in the osmolarity in this table. So let me explain this thing for you. So let us suppose here, initially, see I have already explained you here also regarding this compartment and the fluid movement. So let me take this example of hyperosmotic volume expansion and explain you once again. This is the ICF compartment of the patient and this is the ECF compartment of the patient. What happens is he's taking more NaCl, right? There is increased intake of NaCl that causes hypertension in the patient. So when a patient is taking more of NaCl, what happens is initially the osmolality of the ECF increases because you are adding more solutes, right? NaCl is the ions only. So you are adding indirectly more solutes to the patient body, or the person is taking more solutes. So what happens is initially the osmolarity of the ECF increases. This indicates the osmolarity at y-axis. So initially the osmolarity increases, whereas the ICF osmolarity is normal. I already told you that from the low osmolar solution to the high osmolar solution, the fluid movement always occurs. So comparatively, here it is high osmolar and this is normal, that is low. So always the fluid movements occurs in this direction, right? From the low osmolar to high osmolar. So what happens finally is, look at this. The ICF volume increases when compared to the previous, whereas the ECF volume contracts, right? the ECF volume increases and the ICF volume contracts because it is giving all its fluid towards the ECF. The ICF volume contracts, whereas the ECF volume increases. Since more amount of fluid is gone from this direction, like from ICF to ECF, what happens finally is the ICF osmolality also increases. See, whenever from a container which is having the fluid as well as the solutes, you remove more amount of fluid from this. Like you are removing more amount of fluid and giving it to ECF. Let us suppose this is the ICF compartment and removing more amount of fluid, you are giving it to ECF. What happens is you find more amount of solutes, right? Less fluid. So that indicates that indirectly the osmolarity of ICF is also increased. So always remember guys, fluid is inversely proportional to the osmolarity. So whenever the fluid is more in a compartment, that means the osmolarity is low. And whenever a fluid is removed from a compartment, that means its osmolality increases. So here the same thing is happening. The fluid is removed from ICF to ECF. That's what is happening. So osmolality of ICF increases and the volume as well as osmolality of ECF also increases. So that is what is happening when a patient is taking or when a person is taking increased intake of sodium chloride. So that is explained in the Darrow Yannet diagram here. ICF volume is decreased because more amount of fluid entered into the ECF. Therefore, the ECF volume increased. And since the patient is taking NaCl, the osmolality of the ECF is increased and the fluid from the ICF is gone, more it is gone into the ECF. So that causes the rise in the ICF osmolality. Here the ECF osmolality also raises because of the intake of NaCl. So this is the example of intake of NaCl in a hypertensive patient. Now coming to the fourth diagram. So the fourth diagram here indicates this is black to black is normal, right? And the ICF volume here is increasing. Okay. And coming to the green, the ECF volume is contracting, right? It's moving inward. So ECF volume is decreasing. And look at the osmolarity. This is the normal osmolarity up to this level, but here it is decreased. So osmolarity is decreased. So let me write it for you. The osmolarity of both ICF and ECF is decreased, whereas the volume of ICF is increased and the volume of ECF is decreased. So this diagram here indicates the loss of hypertonic fluid, guys. So here this is the example of loss of hypertonic fluid. So in the fourth condition, you have loss of hypertonic fluid, guys. So this condition represents loss of hypertonic fluid. So that is resulting finally in the hypoosmotic volume contraction. So let me explain this term for you guys. So when you are describing the condition, you always write it at the end result, okay? End point, what is the diagram that you are getting? That you have to mention. See, at the end point, the osmolarity is decreased. So you write it as hypoosmotic. And this volume contraction or expansion term is always dependent on the ECF volume, guys. So here the ECF volume is decreased. Since the ECF volume is decreased, you write it as volume contraction. When you mention about the Darrow Yannet diagrams, please look at the final outcome of the diagram. If the osmolality is decreased, it is called as hypoosmotic or hypotonic, and the volume contraction or expansion depends upon the ECF volume. The final ECF volume is decreased, so you mention it as ECF, that is the volume contraction. So hypoosmotic volume contraction is the end point result, and it is because of the loss of hypertonic fluid. See guys, let me explain you this term simply. If you have a container, from a compartment, if the hypoosmolar fluid is gone, hypoosmolar meaning a fluid with less number of solutes is gone. So what happens is more number of solutes gets accumulated in the compartment, in the final compartment, right? So that means it becomes hyperosmotic or hypertonic. So whenever there is a loss of hypoosmolar fluid, that results in hyperosmotic condition. Similarly, when you have the fluid here and there is loss of hyperosmotic fluid, let us say hyperosmotic fluid is gone. That means the fluid that you are removing out of this container is having more number of solutes. So what happens is the compartment will be left over with less number of solutes here and there. So that results in the hypoosmotic solution at the end, right? So whenever there is a loss of hyperosmotic fluid, the resultant condition will be hypoosmotic solution. Whenever there is a loss of hypoosmotic fluid, the resultant will be hyperosmotic condition. So this is as simple as that, guys. Whenever the solute's concentration decreases, the osmolarity decreases. And whenever the solute's concentration increases, osmolarity increases. Since here the solute's concentration is decreasing. The solute's concentration is decreasing because the fluid that is gone is having more number of solutes. That will result in the hypoosmotic solution. And here, since the solution that is lost is having less number of solutes, hypoosmotic fluid is gone, the resultant will be hyperosmotic solution. So that is what you have to remember. So the similar thing is happening in this diagram, right? So look at this diagram. I have told you that there is a loss of hypotonic fluid. So whenever you discuss about a loss, you have to always start with ECF. So from the ECF, the hypertonic fluid is lost. Since the hypertonic fluid is lost, that is the osmolality is lost, that results in the decreased osmolality level of the ECF. Since the ECF osmolality is now decreased compared to the ICF, the fluid movement occurs from which direction to which direction? You only tell me. The ECF osmolarity is decreased because of the loss of some fluid, which is a hypertonic fluid. Now the ECF osmolarity is low compared to the ICF, which is normal. So the movement of direction of the fluid should be in this direction, right? So the fluid is moved from ECF to ICF. So what's happening? ICF volume expands. You are understanding, right? So initially, there is a hypertonic fluid loss from the ECF. That results in the decreased osmolality of the ECF compared to normal osmolality of the ICF. So I have already told you that the fluid movement is always from low osmolar to high osmolar. So the fluid is moving from ECF to ICF. So finally that results in ECF fluid volume decreases whereas ICF fluid volume increases. Look at the diagram. ICF fluid volume is increased and ECF fluid volume is decreased. So that is what I have mentioned here also. ICF increased and ECF decreased. So this is seen in whenever the hypertonic fluid is lost from the body. So the examples of loss of hypertonic fluid from the body is Addison's disease. And when a patient is on loop diuretics, or when a person is on loop diuretics, or when a patient is suffering from the Addison's disease, you see this condition. So let me explain you in detail about the Addison's disease. Like in short, I will tell you. See, Addison's disease, what happens is, there is decreased, that is Addison's disease is nothing but adrenal insufficiency, right? This every one of us know. So there is a decreased in aldosterone levels. So in our body, what aldosterone does is, from the collecting ducts, aldosterone reabsorbs the Na+. So along with that, the water is reabsorbed into the body. Okay. So whenever there is this aldosterone deficiency in the body, this reabsorption does not occur. So more of NaCl and water moves out of the body. More of Na+ ions and water moves out of the body. So more Na+ is moving out. That means hypertonic fluid is lost from the body. So hypertonic fluid is lost in the Addison's disease. So that's why you will get the fourth type of Darrow Yannet diagram, right? Look at this. Loss of hypertonic fluid, which is seen in Addison's disease and the patient on loop diuretics. You see hypoosmotic volume contraction. So let us find that thing in the table also. So hypoosmotic volume contraction is seen in adrenal insufficiency, which is Addison's disease. And here I am adding one more point also, that is loop diuretics. When a patient is on loop diuretics also same happens. See, firstly what happens? ECF volume decreases, okay, and ICF volume increases, and overall osmolality decreases because it is hypoosmotic volume contraction. So 4 of the diagrams are done. Let us discuss about the fifth one. So when we talk about the fifth one, the osmolality normal is at this level and the osmolarity of red line and green line decreased. So in total, both ICF and ECF osmolarity decreased. Coming to the volume discussion, so the ICF volume is increased, it's going towards the left, and the ECF volume is also increased, it's going towards the right. So volume of both ICF and ECF is increased. So since the volume is increased in the final, like ECF volume is increased at the end point, you call it as volume expansion. So that thing is clear. And whether it is hypoosmotic or hyperosmotic, look at the osmolarity bar. It is decreased, right? So it should be hypoosmotic volume expansion. So this condition is the hypoosmotic volume expansion. Now look at this table, the fifth one, which is hypoosmotic volume expansion, that is seen in SADH. That is syndrome of inappropriate antidiuretic hormone. So here the ECF volume is increasing and the ICF volume is increasing, whereas the osmolarity is decreasing because it is hypoosmotic. So let me explain you about the SIADH. I have told you about the Addison's disease, right? So let me explain you about the SIADH now. See guys, in SIADH, the term itself indicates it's syndrome of inappropriate antidiuresis hormone, right? So there is an increased antidiuretic hormone production in the body. So from the collecting duct, what happens is antidiuresis. That means outside flow is stopped. That means there is more absorption into the body. So more amount of fluid is absorbed into the body in SIADH, right? So this is like water gain only. This is like the hypotonic fluid gain. In ADH, it is purely the absorption of water, not with the solutes. It absorbs more amount of water into the body. So that means you're adding into the body some fluid which is less of solutes. So that means you're adding hypotonic fluid into the body. You're adding hypotonic fluid into the body. So whenever you are adding a hypotonic fluid into any compartment, that means eventually you will decrease the osmolarity of the compartment. So in a container, you have more number of solutes. Let us suppose this is the normal. And you're adding more and more only water into this compartment. So what happens? Number of solutes decreases, right, comparatively. So whenever the number of solutes decreases, that results in decreased osmolarity. So that is what is happening in this Darrow Yannet diagram. The osmolarity of the final solution is decreasing. Okay, so here you are adding more and more hypotonic fluid into the body, which first enters into the ECF. That causes increased volume of ECF and decreased osmolarity of the ECF. So the fluid moves from low osmolar to high osmolar. So initially the changes occurred only in the ECF compartment. And till then the ICF was here only. Like the ICF level is still here. The osmolarity is still here. Now when the osmolarity of the ECF is decreased, the fluid starts moving from ECF to ICF, causing the expansion of ICF fluid also. So finally that results in increased ICF volume, and initially it is increased ECF and overall osmolarity is decreased. So this is seen in gain of hypotonic fluid, which finally results in the hypoosmotic volume expansion, that is seen in SIADH. Now let us discuss about the sixth one. In sixth one, look at here. The osmolality of both the compartments is increased. Both ICF and ECF is increased. Coming to the volume, the green line is receding and the red line is also coming towards the inside. So both volumes, that is both ECF volume and the ICF volume, is decreasing, right? So this kind of condition is seen whenever there is a loss of hypotonic fluid. Try to analyze, guys. So there is a loss of hypotonic fluid. That means there is loss of more water from the body. That means the solutes are accumulating in the body. Whenever the solutes accumulate in the body, the osmolarity increases. So that is what is happening. Osmolarity is increased because there is a loss of hypotonic fluid. So what are the conditions in which this loss of hypotonic fluid is seen? Example is sweating, fever, and diabetes insipidus. So diabetes insipidus is an important condition. See, SIADH is having inappropriate production of antidiuretic hormone, right? Whereas diabetes insipidus is having decreased amount of antidiuretic hormone. So exactly opposite thing happens, right? See, the osmolality decreasing here, the osmolality is increasing here. And the volume of ICF and ECF is increasing in the SIADH, whereas the volume of ICF and ECF is decreasing in the diabetes insipidus. So you can remember like SIADH is inversely proportional to the diabetes insipidus Darrow Yannet diagrams. So this is easier, right? The last two diagrams. For SIADH, you have to remember only the SIADH, that diagram, only SIADH is the example. Whereas for the last one, it is sweating, fever and diabetes insipidus. So let us see the table which is having last one, which is hyperosmotic volume contraction, because at the end you got increased osmolality and the volume is contracting from both ECF and ICF. So you call it as hyperosmotic volume contraction. That is seen in fever and diabetes insipidus. So the ECF volume is decreasing, ICF volume is decreasing, but the osmolality of both the compartments is increasing. So this is all you need to know about the Darrow Yannet diagram. So there is nothing to by heart in this. You have to like think it properly and then answer, so that you will not make any mistakes from this topic. I hope I have made these concepts clear for you, and I have given all the possible examples that they'll ask you in this topic. Now let us try to solve this, guys. So here the osmolality is mentioned in y-axis and liters, that is volume, in x-axis, and the dotted lines are after the changes, guys. So here the dotted lines are after the changes, whereas the normal black line is the normal one. So look at here, the ECF and the ICF. So osmolality is remaining same, right? Almost same, whereas the ECF volume is decreased. So there is something lost from ECF, and the lost one is isotonic fluid, because the osmolality is same in the diagram. You have to conclude, you have to come to the answers like this. So isotonic fluid loss is seen in the ECF. So the condition, it might be diarrhea. So let me reveal the answer, that is diarrhea. Then coming to the second one. So look at the second diagram. What's happening here is the osmolality is increasing, okay, and coming to the volumes, the ICF and ECF volume both are decreasing, right? See, it is going inward and it is also coming inward. So ICF and ECF volumes both are decreasing, whereas the osmolality is increasing. So that means there is a loss of hypertonic fluid from the body. There is a loss of hypotonic fluid from the body, right? Because ECF and ICF volume is decreasing, that means there is a loss of fluid. And since the osmolarity is increased, the fluid lost must be hypotonic. Some water-like thing is lost from the body. So the condition here is lost in desert, that is the sweating. Or it may be related to SIADH, diabetes insipidus, right? Sweating and diabetes insipidus goes together, right? Example wise, it is opposite to SIADH. So here it is sweating, that is loss of hypotonic fluid, that is diabetes insipidus and sweating. Now coming to the third one, look at here, the osmolality is decreased, look at the dotted line, and coming to the ECF volume, it is decreased, whereas the ICF volume is going towards left, that is increased. So since the osmolality is decreased, that means there is a loss of which fluid? There is a loss of hyperosmolar fluid or the hypertonic fluid. So whenever there is a loss of hypertonic fluid, that should ring a bell that there is a deficiency of aldosterone. So it might be Addison's disease. So look at the, yeah, this is adrenal insufficiency or Addison's disease, where there is loss of hyperosmolar fluid. So ECF and ECF volume is increasing and ICF volume is decreasing. Coming to the fourth diagram, look at here, the osmolality is almost same, but the ECF volume is increasing. That means there is isotonic fluid addition, fluid intake. So that might be infusion in shock. So this diagram is the infusion of isotonic NaCl in shock. Now coming to the fifth diagram, the osmolality is increased, right? Here it is increased. And coming to the ICF volume, it is decreased, whereas ECF volume, it is increased. So since the ICF volume is decreased and the ECF volume is increased and the osmolality is increased, that means there is a gain of hypertonic fluid, right? There is a gain of hypertonic fluid. The gain of hypertonic fluid is seen in conditions like excessive NaCl intake in hypertensive patients. Coming to the last diagram, which shows decrease in the osmolarity of both ECF and ICF and increase in the volume of both ECF and ICF. So look at this. This should be exactly opposite to this diabetes insipidus, right? So ECF ICF volume decreasing, ECF ICF volume is increasing, and osmolality is increasing in diabetes insipidus, whereas osmolality is decreasing in the SiADH. So these are the important Darrow Yannet diagrams for you. So if you have to by head this topic, I don't know guys, you might get confused. There are no mnemonics for this topic also. There is only one important relation, that SiADH and diabetes insipidus are opposite in direction in regards of diagram. So yeah, this is what I plan to explain in Darrow Yannet diagrams for you. Please try to solve the questions from this topic guys, so that you will not make mistakes. Yeah, if you have any further doubts, please let me know in the YouTube comment section and in our Telegram channel. So the links are provided in the description below. Thank you.